onto your hand, on the palm of your hand, like that. Something you often see a nervous man do in a film before he meets his date. We've all seen it, haven't we? But is that a good way of telling if you've got bad breath? If you do worry about it, what could be causing it? And more to the point, how do you get rid of bad breath? Well, Dr. Jagmail Basrai is from Chafford 100 Dental Care in Grays, and I spoke to him before his surgery this morning and started by asking him what actually causes bad breath.
Well, there's a number of causes of bad breath. Basically, bad breath, another term for bad breath is called halitosis. That's the proper descriptive name for it. But it's basically a breakdown of proteins of bacteria, either in your mouth or in your esophagus or in the stomach. So, for example, if it's in the mouth, the bad breath can be caused by tooth decay, food getting trapped in between your teeth, but sits there and resides there, and that can give you bad breath. Obviously, foods that you eat, such as garlic, that can give you bad breath, which is obviously quite temporarily.
Yeah.
Obviously, some patients or some people complain of dry mouth, and saliva acts like a natural detergent or a natural buffer. And when they have a dry mouth, obviously that buffer or that natural cleansing action of the saliva, which helps to get rid of the bacteria in your mouth, can cause bad breath. So, there's a number of obviously causes of bad breath. But another cause of bad breath is obviously when you wake up first thing in the morning.
Yeah.
People have morning breath. The term morning breath resides in the fact that because your mouth dries up, there's what we call a post-nasal drip where from your sinuses, stuff is kind of dripping on the back of your throat.
Yeah.
And you wake up in the morning, you've got all that phlegm and everything like that, and you're trying to clear it. So every man, or who can probably relate to this, is trying to clear their breath and trying to clear their throat, I should say, rather. Because of this post-nasal drip.
So that's quite a common thing for all of us to get, is it? Because as you say, our mouths have dried up during the night, and some of us had our mouths open as we've been snoring. So all those sort of things.
Absolutely, yeah. Well, morning breath is quite a common occurrence. I mean, they were saying about over a quarter of adults in the UK suffer from bad breath at some time or another.
Right.
Either it's a temporary thing or it could be a permanent thing. Obviously, you can go and see either your GP or if it's a problem, or your dentist.
Yeah.
I think your dentist will be your first port of call.
But you also said that it could come from the esophagus or it could come from the stomach. So it might actually indicate there was something wrong down there.
Absolutely. For example, with regards to the stomach, it could be something like a reflux esophagitis, so acid coming from your stomach into your mouth.
Right.
Or if there's a foreign body in the esophagus, whatever, and you're trying to expel it, that can give you bad breath as well if it's just sitting there. So yeah, I mean, it can be a serious situation, a serious scenario. So
how do we actually know if we've got it? Because it's very hard to smell your own breath, isn't it?
Absolutely. Well, obviously, if you've got a great partner,
have a smell.
I could tell you straight away.
Yeah.
Boyfriend or girlfriend. So obviously, there will be the first port of call. But one of the common tricks is to lick the back of your hand.
Yeah.
And get to smell that, okay?
Why does that
alternatively,
work?
You did mention...
Sorry to interrupt. Why does that work rather than just sort of breathing into your hands?
Well, basically, the dorsal surface of your tongue, the top aspect of your tongue, has the most bacteria sitting on it.
Right.
So, and they are the number one reason why people get bad breath, because the bacteria sits on the dorsal surface, the top surface of your tongue.
Right.
Hence, if you lick the back of your hand and you get to smell it, you can smell a kind of hydrogen sulfide kind of smell, a sulfur smell. That will give you an indication whether you've got bad breath or not. So one of the kind of treatments of bad breath is to actually use a tongue scraper to actually clear that bacteria and that debris off your tongue, which a lot of people don't actually remember. They clean their teeth. Flossing is very important as well, because obviously it helps to remove food in between your teeth, which can be sitting there and harboring. Because I tell my patients, brushing is only, cleans 70% of the tooth surfaces, and flossing and any other incidental cleaning aids cleans the other 30%. So there's various mouthwashes out on the market which help to remove bad breath. And I can't mention names, but obviously, what you have to be wary of is mouthwashes that have any alcohol in it.
Right.
They can cause bad breath, believe it or not. So
because I was going to ask you about that. I mean, there are loads and loads of mouthwashes on the market, but I've read in the past that some of them can be, pretty bad for you.
Well, that's because they have a very kind of acidic pH,
Yeah.
i.e. a low pH. So if you are brushing your teeth and you're using a mouthwash which has got a low pH, that's like washing your mouth out with battery acid, or a cola drink,
Yeah.
So hence it can cause erosion and wear in your teeth. And what they have found, scientific studies have found, is that people who smoke and use these kind of low pH mouthwashes are also prone to oral cancer.
Ooh.
So that's another kind of a scenario, obviously a worse scenario than having bad breath.
Just going back to the telling if you've got it. Yeah. You were going to say something else to me. I interrupted you. Licking the back of the hand is a good way.
Obviously, cupping your hands, you can obviously smell that.
Yeah.
There is various practices that have a machine called a halometer, where you blow into this machine, and it gives you an indication of how much of the concentration of sulfur compounds are in your mouth.
Oh wow!
And obviously, it's a bit like, I suppose, breathing into a kind of like a breath. When you get arrested, whatever, for like drinking and driving, one of those analysing things. Yeah. It's very similar to that, but it gives you an idea of how bad the breath is actually, from there as well. It's more of a scientific way, but then, like I said, there is various mouthwashes that actually do help to reduce the hydrogen sulfide compounds in your mouth. I don't know whether I'm allowed to, Dave, mention any names in particular. Am I allowed to mention a name?
Probably not a good idea.
Okay.
But yeah, I mean, what you're saying is avoid the ones with
alcohol,
the
a high concentration of alcohol.
Yeah. Okay.
But there is mouthwash. If your obviously listeners Google certain mouthwashes which help with bad breath, and they'll be able to obviously detect it themselves and find out.
So the mouthwashes are good. Obviously, good oral hygiene has got to be good. Brushing your teeth. And I didn't realise you were saying that scraping the top of your tongue.
Yes.
And a lot of toothbrushes now advertise the fact they've got one of these on them. I thought that was just a gimmick. So you're saying that's actually quite a good idea,
Yeah,
right?
it's an absolutely fantastic guide. It's like killing two birds with one stone. Where you are brushing your teeth, and the back of the brush has this kind of like a rubber kind of mesh on the back of it, and you use that or you can buy an alternative tongue scraper. That's a simple measure. But if you've got tooth decay as well, I mean, the food was sitting holes in your teeth, whatever. And obviously, flossing and all that stuff. So your dentist is a kind of the main port of call, but there is various obviously treatment options available to you. But just simply cleaning the top part of your tongue with a tongue scraper or your brush, the back of your brush, will do amazing, make an amazing difference to you.
And from what you were saying earlier on, I guess also just keeping yourself well hydrated. Just drinking lots of water and so on, and keeping the mouth.
Drinking plenty of fluids. But trying to avoid sort of like coffee and stuff like that will help. Also, using sugar-free gum. If your mouth feels dry, you can obviously use sugar-free gum. That's a very cheap and easy way to do that. You can maybe eat more vegetables in your diet, fibrous vegetables, which will help to kind of remove any plaque around your mouth. So that would help in itself. So yeah, and regularly visiting the hygienist or the dentist to have them cleaned as well. That would really, really help with bad breath as well.
I've got to ask you this. How do you, as a dental surgeon, put up with people's bad breath? I mean, you're very close to them. How on earth do you do it?
Well, bad breath is. We kind of adhere to strict kind of cross-infection procedures. Every dentist should, but we wear masks, and I get patients coming up to me and they said, my girlfriend says, I've got really bad breath, and then and I said, well, I get a little bit of floss in between the teeth, and I get them to smell that. And I said, well, actually, can you smell this? And they said, oh my God, is that me? I said, well, that's you, and So we don't try and pull any punches, but I'm so used to it now. By wearing a mask and changing it regularly, it kind of like gets away from that problem. To be honest with you.
What a good chap, eh? What a good chap, Dr. Jagmel Basrai from Chafford 100 Dental Care in Grays. Go on, have a lick. Have a lick now, right now, if you get the chance. Like that. Oh, not bad. Not bad at all today. If you'd like to report in to me, that'd be fine. Just text me on a scale of 1 to 10 how you feel your breath is today. 07786 201035. Do I really want to know?